It goes so much deeper than just, okay, go to a chiropractor, get adjusted. You've got to make sure the muscles are balanced. So, I muscle test and strength test and make sure there's a balance between front and back, left and right, obliques, the side to side, and that everything is firing and stabilizing in its proper motions. And so we get tighter as we age. Our fibrous connective tissue sort of dries out and turns into like a beef jerky. And if we can keep that lengthened and keep it functional, you keep your mobility, you keep your function, yes, it's 100% going to affect your health and longevity.
Health, fitness, mindset, nutrition. Live better and longer. I'm Saad Alam, and let's hone in.
You're a chiropractor. And when most people think about going to a chiropractor, it's constantly because I have some problem, I need to get adjusted, there's a bunch of cracks. It is very often associated with pain. But the reality is when we spoke, you said it's so much deeper than that. And I'd love for you to talk about how much more beneficial treatment can be than just going and getting adjusted.
I think, the greatest thing about chiropractic and the profession of chiropractic is there's over 300 different chiropractic techniques. Mm-hmm. Now, that is also a detriment to our profession because a lot of people don't even know what chiropractic is. So I think the advice is, to people listening is find a chiropractor that specializes in what you're looking for or what your needs are or what your expectations are. And my type of chiropractic or the way I practice, I believe is more in lines with the sports chiropractor. And so I look at the body as a whole from head to toe. I'm looking at the musculoskeletal system. I'm looking at the nervous system. I'm looking at how joints align. I'm looking at how the body moves. And, my treatment involves everything from adjusting and mobilizing joints to lengthening fascia, activating muscles, stabilizing joints. And then I get into then secondary levels of stress, of nutrition, of mental, social balance. So I try and encompass every aspect of that. There's not every chiropractor has the time to do this. Unfortunately, we're limited by insurance, and the insurance is now paying $20 to see your chiropractor. The chiropractors are forced to see 50 or 100 patients a day. And so it sort of changes the what a chiropractor does, and it changes the sort of how they treat you. So, if you can afford it, then find one that will spend a lot more time with you. If you can't, just getting joints mobilized is crucial.
What do you mean by having joints mobilized?
As we go through the day, and I'm sure everybody's experienced this, you sometimes you're like, okay, I feel a little kink in my neck, or I feel a little pain in my back, or if you're rolling on the foam roller and you're like, it feels like there's a rib sticking out of my back or something. And when you first notice it, it's painful. And usually it's a joint that's out of alignment or restricted, not moving properly. And the body responds to that by sending inflammation to that area. And inflammation carries fibrinogen, which is this little fibrin tissue that then is laid down around the joint. And the body's purpose is to kind of isolate the joint or immobilize the joint to stop it creating pain, to stop that inflammatory cycle. So the inflammation is what gives you that initial pain. And then oftentimes we don't do anything about it. And 3, 4, 5, 7 days later, it's like you forget about it. You don't feel it anymore. So when patients come to me and I'm checking their spine, I'll feel a rib that's slightly subluxed or out of place, and I'll put my finger on it and push on it. And they're like, oh yeah, that hurts right there. And I'm like, oh yeah, you've got a rib out of place. Oh, wow, that hurt a week ago, but it's gone away. So the body kind of deals with it in a way of just isolating it, reducing the mobility of it. But then when you go to a chiropractor, we can find those joints that are not moving and adjust them. and induce motion back into that joint or put that joint back in place so the joint continues to function. A joint that is immobilized or dysfunctional degenerates faster than any other joint.
Is it too much to ask, why does it, we'll call it atrophy or degenerate faster than a joint that is moving? Because it almost seems counterintuitive. If it's immobile, maybe I'm not using it, versus if I'm using it all the time, maybe it would wear out faster.
Okay, that's great. Hold that thought, but it just makes me think of something else, because we used to believe that running long distance degenerated your knees.
Mm-hmm.
And forever I'd hear orthopedic surgeons saying, oh, you got to stop running, you're degenerating your knees, you're wearing your knees out. Whereas a study came out, I mean, it's like 5-6 years ago, where it followed elite marathon runners over their lifetime. So when they were competitive marathon runners and up the continued running up until their 60s. And they found that they had 30% thicker cartilage in their knees than the equivalent non-runner. So back to our SAID principles, you want to stress the system and your system grows stronger. So now with looking at an immobile joint, it doesn't wear out. Joints don't really wear. A healthy, moving, balanced joint doesn't wear out. A joint that wears out is a joint that's out of alignment or out of balance. So if you think of the wheels in your car, and you're driving your car, and if your wheels are out of alignment, they're going to wear out faster because there's more stress on the tread of those tires. Where if they're perfectly aligned, the same with your joints. If all your joints are perfectly aligned and moving well, they're not going to wear out as fast. An immobile joint, so we have synovial fluid inside a joint. So as your body's moving, it's getting this synovial fluid around the whole joint. Synovial fluid is rich in nutrients and oxygen. So it's getting this nutrition and oxygen around the whole joint. If a joint is only moving one direction or not moving in all directions, that nutrition and oxygen is not getting to the whole joint. The joint degenerates faster.
That makes so much sense. And it gives me, how sometimes they say that your health or your longevity lies in the diagnosis of your physician. And what I mean by that is, very often when you meet a physician, they say, hey, look, things look really bad. And you automatically go, oh, my doctor, who's the expert, said things look bad. And you automatically kind of down-regulate your expectations of what good looks like, or if you're ever going to be healthy. The fact that I've started running pretty extensively, and you just said that, I think unlocked a tremendous amount of confidence in myself about making sure that if my joints are quote unquote aligned, it may actually increase my longevity. Is that just a reach of a statement that I'm making?
No, I think it's 100% true. 100% true. If your body is functioning properly, it will last longer. It's like tuning up your car. So, and it's not just it goes so much deeper than just, okay, go to a chiropractor, get adjusted. You've got to make sure the muscles are balanced. So, I muscle test and strength test and make sure there's a balance between front and back, left and right, obliques, the side to side, and that everything is firing and stabilizing in its proper motions. And so we get tighter as we age. Our fibrous connective tissue sort of dries out and turns into like a beef jerky. And if we can keep that lengthened and keep it functional, you keep your mobility, you keep your function, yes, it's 100% going to affect your health and longevity.